A very good morning, Doctor. My name is Thurga Nandini, daughter of Muthu Kumar, and I'm from Faculty Wellness. Okay, today I would like to summarize the talk given by Dr. Afifuddin from University of Malaysia Science. That day, the program is held on 24 November. The talk is about mental health illness. So, from that talk, I would like to implement it about proceed model. Okay, normally during notify the focusing on the talk that given by Dr. Afifuddin. So I would like to apply one model which is known as proceed model that consists of four elements, important elements. First phases is known as social diagnosis. Second phase is known as epidemiological diagnosis. Third process is known as behavioral environment, and the fourth phase is known as educational and organizational diagnosis. So in here I would like to implement it, the phases which are known as first phases, social diagnosis. Okay, in the program of mental health disorder that given talk by Dr. Afifuddin, I have learned he is implemented that proceed prostate model, which is social diagnosis is implemented about social awareness program. Okay, before we creating a program, we need to identify what kind of problems basically is that the participations is having. All right, and then it's known as like a structure of assessing health needs for designing, implementing, evaluating, perhaps towards the public health program. So whenever a person is implementing a program, so they should undergo of four phases. The first phases will identify about the precautions of the consequences of the program, right? Therefore, I would like to define the structure of social, the phases one social diagnosis is reflect about a model is a comprehensive structure for assessing health needs. For example, designing, implementing and evaluating health pros and cons towards public health program, right? And it also provided a structure for planning towards a target marketed peoples who are we are giving our health programming, who are our target market. For examples, it will be the public. Yeah, it's considered about public health program. So in order to that consequences, so implementing of a health mental health program is really undergoes in first phases known as social diagnosis. So in additional, today I would like to share the information that I gather from the online awareness campaign program that given a speech by Dr. Afifuddin on 24 November, as I said earlier. So what are the informations that I gain? Okay, the causes of mental health and the ways overcome for mental health. Two important elements that are importing towards that day of talk. So actually what the factors that lead us to mental health illness? First is depress is known as stress. Actually stress is the main implemented which lead to depress. So somehow depress is a situation is that becoming complicated, negative impact lead us to mental health. Normally a persons who are like stressed, normally mental health illness is normally targeted towards students, university students, school students, because they are nowadays are busy with their online task, online assessments, online 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 platforms of learning, right? So therefore lack of facilities like cannot access Wi-Fi and network problems. So these are kind of things that can increases their stress and lead to mental health disorder. Other than that, people are like isolated, ignored by someone. For example, elderly people are normally isolated to compared to teenager people. Normally, why this is I'm saying, right? Elderly people are common the person who are like need a lot of attention from their children, from their care persons. So since there are lack of importance given by towards them, they may be isolated. For example, I would like to give current issues that happen in Malaysians during outbreak of COVID pandemic, COVID-19. A lot of elderly people who are like placed in orange places, they are being isolated since elderly people are easily to separate of COVID-19, and they are isolated in a nursing home since around 3 months something, because lack of facilities in hospitals are provided. Therefore, they need to isolate it from other persons. Since a lot of uncare thing and they are like ungive of moral values towards them, they being towards the mental health. And then some of the factors which are lead, which is right, for example, is breakup is among teenagers or one kind of things. Okay, ways to overcome of ways to overcome mental health illness is, as Dr. Afifuddin said, that we need to see psychiatrists, for example, psychosocial, right? We need to refer to psychologists, counseling teachers, but whenever we refer towards counseling teachers, psychiatrists, maybe they can give you a lot of guidance to overcome your mental illness disorder. For examples, way to reduce stress, how to handle every problems in a easy method. Like for example, we need to smile. Okay, in my opinion, every problem is facing by everyone. The first thing we need to think is think positive, smile always, like be happy. Okay, don't take negative thoughts, negative mindset, because negative things can give you direct proportionals of things impact, right? So therefore, breathing skills that teach by Dr. Afifuddin, it's really a benefit to me, because during classes schedules so too tight, I always like doing breathing skills. For example, whenever we had a stress, we can doing breathing skills. For example, inhale of breathe, exhale. So whenever we inhale and exhale, it will regulate our body mindset, regulate our breathing circulations. Therefore, the hemoglobin inside our body will transfer to active moods, right? So it will regulate our body balance. Therefore, a circulatory of a perfect systems inside our body can overlook our positive vibes around us, right? Thank you so much for landing here, doctor. These are the main things that I would like to share towards you. And the last things is, right, what are the ideas that we can implement it towards the future planning of program. Idea is, normally we can do another as usual people are doing online programs talk, right? So we can implement a lot of quiz task, right? So maybe it will be not becoming a boring mood, right? All right, it will give like interesting things, right? Like for example, if a talk in the length of duration 2 hours, means around 30 minutes we do like exercises, quizzes, game, our QA sections is the length of things, and we give out prizes to person who are like asking questions. So these are the things that I will share in the video. Thank you. And the last but not least, preset model means pre-disposing, reinforcing, enable construct in educational program, right? And it will be evaluated at the end of the day, and it involves accessing the following of community factors. All right, thank you so much, doctor. Thank you so much.